So
Right.
what are some things now you think that men can do to better assist their partners during pregnancy and I guess post-pregnancy because that's important too.
So I tell all of my families that as much as the gestational or pregnant person thinks that the doula is just for them, we're not. I love partners. Partners is one of these spaces where I fold because I tell people I feel like partners are the most vulnerable person in the experience because they don't always know what to do, but they want to help. They don't know what to say, when to do, how to do, or they feel like it's a woman's thing, or there's no space for me in that. Um, Back for some of us, depending on the years that we were born and things that were going on family wise, especially even with our parents, men were quote unquote not allowed in the birthing space. They didn't have a place in the birthing space, but they had a place in getting to that space. They had a place in helping to create this life. And a lot of times we hear men like, well, I was just there. I didn't know what to do because men don't always know how, or they're not taught. They're not encouraged and told that, no, this is about you. And so one of my things that I always tell my clients is make sure your partner has my number. Make sure your partner knows they can reach out. And I love it because partners have questions, they have
Yeah.
needs, they have concerns. Whether it's a hospital birth, a home birth, a birthing center, I always tell partners, this is about you too. Just because you're not the main character, just because you're not the person in this bed or in this space to give birth, does not mean that you don't have a part in this. And so that's when I have sessions sometimes one-on-one with partners, especially when I'm seeing certain types of, energy, or they're kind of standoffish, or they're always looking at their partner to answer questions. And I'm like, what about you? How do you feel? What are your thoughts? And, pulling them into the conversation. And that's where it starts. Partners being present. They have questions, ask them, ask your peers, ask your parents. It's not necessarily that people are asking for advice, but asking, like, what was your experience? And a lot of times that's one of the biggest things I see is that people always want to give the gestational person, yeah, because when I was pregnant, this happened, I did this.